Hi, good afternoon. I'm Dr. Doug Schultz. I'm the Chief Medical Officer of Shannon Clinic, and I'm proud to say that Shannon was named one of the few hospitals in Texas to receive this initial dose of the Pfizer COVID-19 vaccine. Actually, there's 23 hospitals, so we were one of those 23. So we have gotten our first shipment of 1,950 doses, and those doses, according to the state and the CDC, are to be given to providers who take care of patients in this first round, and then we'll start getting shipments on a weekly basis, and we start doing everybody pretty quickly. Also, in this same group are long-term health people in long-term health facilities. They are partnering with CVS and Walgreens to get their vaccine that way, so they'll be taking care of this first round. Also, we're going to take care of our first responders, EMTs and police officers, and also our regional partners that are in this region, their hospital personnel. So they'll all be taken care of in this first round. So today we have some volunteer physicians to be the first ones to receive the vaccine here at Shannon. So I'd like to introduce them, and then we'll proceed with the vaccine. So we have Dr. Ty Houston, who's the chairman of internal medicine and also the co-chairman of our quality department. We have Dr. Michael Wood, who is the director of our hospitalist program and also the head of our COVID-19 treatment team in the hospital. Dr. Carolyn Ojeda is one of our tremendous internal medicine physicians. Dr. Jenny Wiggins is one of our OB-GYNs and also the chairman of the OB-GYN department. Dr. David Huckton is the chairman of the ENT department, as well as past president of the medical staff. Dr. Scott Gibson is one of our stellar anesthesiologists, and Dr. Fernando Officer is one of our awesome internists as well. So we appreciate all these guys, and I'm going to ask Dr. Wood, who's the director of our COVID health team, to be the first one to take the vaccine, and the rest of you can follow. So, all right, go ahead.
Yes, so I was honored and very fortunate to be the first person here in the Concho Valley to receive the COVID-19 vaccine today. Having battled this disease personally, for the last 9 months, treating hundreds of patients in the hospital and following the science on a daily basis, I think that this represents really our best shot to finally beat it and get back to normal. So I've actually reviewed the data on the phase 1, 2, and 3 of this specific vaccine candidate extensively over the last couple of months, and I think I firmly believe that it's both safe and effective in preventing COVID-19 disease, and so I absolutely had no concerns about receiving it today. So this new mRNA type vaccine with Pfizer has proven a 95% efficacy at preventing COVID-19 disease. It's important to note the traditional flu vaccine is about 70% efficacious. So this new technology is much more effective, and it's really unprecedented. I think we're going to see this kind of expand into other forms of vaccines as well in the future.
The entire day I've been telling patients it's a historic day. This is the first time in our town that we're going to have this vaccine available. It's the first time we've had something effective against this virus that has so much problems health-wise and socially and economically and everything that has come with it. So it's a great day, and I'm happy to participate as a person, as a volunteer, as a doctor, as part of this community to be one of the first ones to get the vaccine. I think we're driven all by science and helping people get better. This is what we do for a living, and when we are faced with a new disease that finally gets a vaccine, I think we should all get it, and of course we all want to be protecting ourselves and our patients from this coronavirus.
So when we talk about the vaccine being 95% effective, it still means that 5% of people could be spreading it. And so I do think it's important that until we really get to a point in the pandemic where transmission rates are lower, cases are lower, that people still need to adhere to the common sense, hygiene practices, masking, social distancing, washing your hands. At least for now, I think the more we do that, the quicker we're going to get back to normal.